Hello, my friends. Okay, so Jill here, and I just got back from my pre-op appointment for my surgery. Today is November 16th, and my surgery is in 12 days on November 28th, the Monday after Thanksgiving. I'm super excited. The pre-op went really well. I got to see a lot of the staff. My mom and dad came with me, and they got their questions answered, and they were very thorough at the office. They even gave me a cute goodie bag with all kinds of stuff. I know my kids always love these cups, so they're going to be jealous that I got another one. Finally, I have one for me. Every time I get one, they steal it. So this one's going to be mine. So I have a cup. They gave me some hand sanitizer, some lip balm, a little mini lips ice pack, a stress boob, and some scar treatment. So they told me that they will let me know when it's okay to start the scar treatment. It may be weeks until after the surgery that I have to actually start treating the scar. So they also took all my money. So I had put a down payment of $719. I added in, they added $500 for a breast cyst excision. They're going to be taking that off, something I needed to do anyways, sending that to the lab. So they do have my insurance information in case that can go through insurance. And then the rest of it, I had paid $719 as a deposit weeks ago when I booked, and the remainder, the total came to 7190 plus 350 I added for the Exparel shot. Now this is something I've seen a lot of people, if their doctor offers it, they take it. My doctor offers it at his cost for $350. So I decided to add that in. It's a pain relief shot. It lasts about 3 days, and they put it right inside before they close you back up. So I added that on. So whatever $71.90 is plus 350, so around $7,600 is the total cost for everything. And that is for the tummy tuck, the excision to the cyst, and the Exparel. It includes the operating room fees, which if you do this at a hospital center, you might be paying higher operating room fees. So it's nice that they're doing it at the surgery center. It's for anesthesia, an assistant, and the lab work. I had my blood taken today for them to do any lab work that they need to do. I also came with my full workup that I had done in March when I saw my general practitioner. I love that they gave me a bound book about me and my surgery, and there's a beautiful table of contents in here, so I'm going to run through real quick. If you have questions, let me know. It has preparing for surgery, medications to avoid, going to the surgery center, general surgical risks, other risks, medications, post-operative care, longer-term post-operative instructions as you heal, specific surgical risks, consent for surgery, post-op instructions, and financial policies. So starting right now, I don't smoke, but it says to stop smoking. So we're almost 2 weeks out. So at the 2 week out mark, this is what they want you to stop doing. It says to stop taking multivitamins. I did bring in my protein shakes, my daily superfood shake that I've been drinking every day for like 7 years. And they looked at all the ingredients. They said I was okay to continue my daily shakes. And I also brought in my workout, my post-workout recovery shake that they said was also okay to continue taking. And I'm hoping that'll actually help me with recovery as well. So it's got great anti-inflammatories and muscle repair stuff in it. It says, starting now, start taking vitamin C. So maybe I'll go grab some of that. It says 500 milligrams of vitamin C twice daily promotes healing. It says do not take aspirin or ibuprofen. You can use Tylenol. Although I don't ever really take much of that anyways. It says to limit vitamin E to 400 milligrams per day. I don't take that. And it says to fill your prescriptions, which they will send to the pharmacy. I did ask what she said. I know she said there was some antibiotics, some anti-nausea, some Valium, and I don't know if there was something else. They also wanted me to pick up a certain type of soap from the pharmacist to shower with prior to my surgery that day. They said do not wear any jewelry, no makeup, no contacts, to wear my glasses that day. I took all my nail polish and toe polish off already. So that's it. I am at least the first appointment of the day, if not the only surgery. Somebody else had called in while I was there, and I heard she was the same day, but I think she had some things that she had to take care of first. So they might not have her surgery. But it says that they're gonna call me to confirm surgery time. They're gonna make sure I have my prescriptions. They said not to eat or drink anything after midnight, including water, but to drink lots of water the day before. That being hydrated is much better for the IV that's gonna be in me. They said do not put on deodorant for that morning either. Don't eat or drink anything. It says you can brush your teeth, but don't swallow the water. Make sure to wash. They said if you're going to shave the day before. No makeup, no moisturizers, no creams, lotions, comfortable clothing, loose-fitting clothing that does not have to go over your head. So I bought some new silky pajamas that are, button down. It says to remove hairpins, don't bring valuables, and I am to be there at 7:20 a.m. The morning of the surgery. And so my husband will have to bring me and pick me up. I'm actually not supposed to drive 2 to 4 days after being under general anesthesia, because if you don't have your full motor skills back, it's not good to be driving in case you have to be reactionary. There's a whole list of medications here to avoid, but I don't take any medications, certainly nothing daily. But it's even down to like Alka-Seltzer and all of that stuff. So it says to stop anything like this now. I'm just checking. I don't see even anything that I really, other than that one that I can even recognize. Like not to take cold medication or anything like that. They are having me do a COVID test the day before and take a picture of the results and email it to them. That way they have that. Let's see. It's a big long list of things not to have. I think they don't want you to have anything that's going to thin your blood, especially. And then there's also stuff to avoid post-surgery. Again, nothing that I take. I don't take anything. It says, let's see. We'll go in, we'll meet. I did ask the doctor how long he thinks I'll be under. He said it could be quicker, but 3 to 4 hours. And then they said that the recovery time is about an hour, making sure that I come out of it completely before somebody takes me home. They said that there could be some swelling, bruising, discomfort, pain, crusting along the incision lines, some numbness, itching. They said numbness, any little pains that you feel could be like the nerves rebuilding and regenerating. It says usually within 2 to 3 months, all of the nerve endings have healed. And with itching, because of these little shooting electrical sensations, when the nerve endings are healing, you might want to use ice or skin moisturizers and massages. But they said that's all normal. Redness, a little bit of redness is fine if it looks really bad or is, in a general area, to give them a call. If there's infection, they would just prescribe another antibiotic probably. So they said that I would probably have 2 drains, and they told me, there's instructions, and they will tell me that day how to empty the drains of the fluid buildup from after surgery, blood, and then when it's like a straw color and there's a certain amount coming out per day, that's when they know they can remove them. They said sometimes it's 5 to 10 days of having the drains in. The sutures will all be dissolvable, so those don't need to come out. They said not to remove the tape or dressing. They do use a glue as well to heal the wound, and they said to just let everything happen as it is. They said it's okay to get everything wet. It's fine. It doesn't hurt healing. So they said that you can shower soon, I think maybe a day or two after, I'm not sure. They said to make sure you wash your hair as you like it, because you may not be washing your hair for a little bit. Let's see. We talked about so I saw the doctor. He took pictures, before pictures, from all different angles. And he kind of like grabbed onto all the skin. He said, all right, we're going to take off all of this. He said he's going to keep the scar very low. And there might be a small little like 1 inch, they call it a T incision, in case there isn't enough to pull down. He said my belly button will be gone. He will be creating a new one. I asked him if I can choose the shape of the belly button, and he said that unfortunately it's kind of like what you come to the table with, is how it ends up being. So I think it's just however your belly button naturally is. I know some people do train their belly buttons and use different size plugs and whatnot, afterwards, but that's something to worry about afterwards. I know that if there's anything that comes out, that's uneven or little, things that need to be repaired or fixed, they can do that under local anesthesia later, but usually you wait a long time, because like 9 months, because it takes time for everything to heal fully and properly. It tells us, how to stay positioned. It says when you first get home, to make sure that every couple hours you're walking around the house, and changing your position to reduce the danger of blood clots. They said I might be fine coming up a few stairs. That's going to be based on my ability. And otherwise, I will be staying probably downstairs here in the living room. It's the only place on this couch here where there's the couch right here. There's TV, and then right there is the bathroom. So that way I can get to the bathroom, and anybody else is going to have to help me get food, water, all that stuff, because the kitchen is a few stairs up, although there are railings here, so that will help if I need to come up. So the plan is to be here as long as I need to, until I feel comfortable going up our big set of stairs there, because my bedroom's up there. Oh wait, that's the kitchen. It's up there. You see those stairs that go up and then up again. So let's see. They said they will send me home. It says we will place a compression garment around your tummy after surgery to provide some gentle pressure to give you stability and reduce swelling. The compression garment is required to be worn continuously for 4 to 6 weeks following surgery, except when laundering and bathing. If it feels too tight or causes pain, call the office. It says we don't want the binder to interfere with the circulation to the skin, which could cause blistering or skin loss. You may remove it temporarily for laundering. Many patients wear the binder for several weeks after surgery, and some choose to wear it for several months. Let your own comfort and amount of swelling you experience guide you. And so a big thing on swelling is you have to be very careful with what you eat. Generally, salty foods are going to make you swell anyways. Having lots of water will help reduce swelling. Making sure that you're emptying your drains and that you're draining properly is also important. And then a big thing too with swelling is not overdoing activity. It says with regards to activities, tummy tucks are probably the most uncomfortable operation we do. You'll experience some pain for 10 to 20 days and not feel like resuming sports or heavy exercise for at least 6 to 8 weeks. He actually said I could go back to golf within 6 to 8 weeks as well. After the first 2 weeks, you may resume moderate walks for as long as is tolerable. Too much activity can prolong swelling though, so that's something that you have to be careful of. With regards to exposure to sunlight, that too, it says we recommend you protect your scars from the sun for a year after surgery. Even through a bathing suit, a good deal of sunlight can reach the skin and cause damage. Wear a sunscreen with a skin protection factor of at least 30 when out in sunny weather. Things that you might feel with regards to the tummy tuck. It says tightness. Your abdomen will feel tight for a month or longer. If you have had a muscle repair as well, which I am not planning to have muscle repair unless he sees a major problem in there, but I've made that clear several times. I want to keep my own abs intact. It says you will feel the most tightness down the center of your tummy where he's repairing your muscles. So a lot of women, when they give birth, their muscles separate. So you can have them pull them back together, and that creates the tightest waistline. I don't care about my waistline. I just want to get rid of all the ugly skin that's hanging down. So I'm happy with the strength of my abs, fine with the look of my abs, fine being more boxy, don't need a tight waist. I'm totally fine with that. I'd rather not have the muscle repair. And it says, let's see, healing of sensory nerves. Usually the skin of the abdomen remains partially or completely numb for several months or longer. Tingling, burning, or shooting pains indicate regeneration of the small sensory nerves. This feeling will disappear with time and is not cause for alarm. It may take as long as 2 years for the sensation in your abdomen to be restored completely. And I absolutely understand because I've had liposuction. I had that in 2014, and I did feel those little weird kind of like twinges. And sometimes I do feel like I feel a little bit of numbness at certain times still. This is years later. Feeling of fullness. You may pleasantly find that you feel full sooner than normal when you begin to eat regular meals. That's nice because I'm always hungry. And so that's it. It says do not plan on resuming aerobic or strenuous exercise for about 6 to 8 weeks. Let your body tell you what it can do. That might be it. This is again just talking about post-op, avoiding stretching and tension to the new wound until it's fully healed. Scar redness, it says it may take 6 to 18 months for the scar to completely fade. Tenderness is gone within about a month, and that's about it. So if you have any questions for me, this is all the information I have until I go in for surgery. I know that he also said alcohol needs to stop a week prior and cannot resume until a week after. So I will be having a dry Thanksgiving, and we are going on vacation this weekend. So I have Saturday and Sunday that I can have the pina coladas with the rum, and then afterwards I'll be having the virgin ones with the kids. So that's it. Again, if you have any questions, let me know. If I'm very happy with the doctor that I chose, and I've heard such great things about him. So that's it. Until next time.